Hello, everybody, and welcome back to DigiFest. The next session up in front of your screen is the Heriot Watt University Robotarium. We've all been practicing to say that. And the session focuses on living labs and co-design for health and social care robotics. This is going to be a really interesting session covering a number of topics which we've touched on a little bit in the program so far, but we certainly haven't come into robotics yet. Co-design and how you involve and work with all citizens and stakeholders in the development of digital health and care services and products is a really challenging and interesting area. So I'm really delighted that we have Heriot Watt with us today, and I'm going to hand over to Professor Lynne Baillie, who is the Director of Interactive and Trustworthy Technologies Research Group at Heriot Watt University. Lynne, over to you.
Hi, thanks, Nessa. As said, Professor Lynne Baillie, and actually I'm speaking to you today as lead for human-robot interaction and assistive living at the National Robotarium. Mauro Dragone is also on this. He is an assistant professor, and he is actually my deputy lead for the National Robotarium for this area. And we're hoping that as we plan, we already have an assistive living lab, but we're moving to a much bigger one, that you will work with us and input to this so that we can actually make the new National Robotarium work for all the stakeholders that we're interested in working with. So next slide. So this here is the ground floor of the new National Robotarium, which we are part of Edinburgh Centre of Robotics, and that goes across Heriot Watt University and Edinburgh University as well. So here we will have on the right-hand side, we will have multiple human-robot interaction labs where we can work with stakeholders to build new and interesting robot interactions. And we also have, as part of that, an assistive living laboratory. So if we could go to the next slide, you'll see the assistive living laboratory that's going to be there, which is brand new. Here it is here. What we have here is a herb to kitchen concept. So actually there will be a garden outside. There's an actual front door, which is to the right. K shows the kind of door. And what we have is they go out into the garden and they can go right to the curb. So we can have interaction going from the curbs, a completely disabled access coming into the assistive living lab, a living room, which is a kitchen, and there's also a bathroom, which has full disabled access, and there's 2 bedrooms. This is in order that a carer can also stay overnight. So we've tried to think of the whole layout of how this will look in order to support the type of research work that we want to do with the robotics. And this will also be a censored environment, as well as having various robots work within it. So on the next slide, I believe, for that, I then go to one of our projects, which is from one of my researchers, Emily Ann.
Hello, we developed a social facilitated memory game that incorporates sensory feedback. The aim of this feasibility study is to inform the design of a cognitive rehabilitation system for older adults with age-related cognitive decline. The older adult population, or individuals over the age of 65, is growing at a rapid rate, resulting in the need for increased mental care. While cognitive rehabilitation has been shown to be an effective treatment, factors such as high demand on limited staff can impede the therapy's potential impact. Also, due to the nature of this condition, decreased rehabilitation adherence is common. Therefore, any system created for this population must be both engaging and motivating. The system was created based on the motivational benefits of a socially assistive robot such as Pepper, shown here, as well as the memory benefits of auditory and haptic feedback. The game requires the user to remember a sequence of body parts and then input the sequence by touching the tactile sensors on Pepper. There are 3 sensory feedback conditions: auditory, haptic, and both. If you'd like to see a demonstration of the memory game, you can scan the QR code here. The system was assessed with 9 young adults. For the sake of time, I won't go through the results. They're shown here in the poster and in the late-breaking report, the link for which can be found at the end of the video. One interesting finding not discussed in the poster is the response we received in regards to the haptic feedback. 4 out of 9 participants found that the haptic feedback was not strong enough, which we believe may account for the unexpected preference for auditory feedback. However, 2 individuals thought that the vibration was strong enough. They were both female, thus accounting for 2/3 of the female participants. These gender differences were unexpected, and we'll be investigating this going forward. Currently, we're focusing on making improvements to the system based on qualitative responses from participants. The next step will be to test the improved memory game with older adults before introducing the system to individuals with age-related cognitive decline. Thank you so much for listening, and feel free to reach out if you have any questions or you'd like to discuss anything further.
So Emily Ann's actually, COVID actually had an impact on her moving forward and doing any evaluations with older adults. So if anybody in the audience is interested in helping or working with Emily Ann, we're hoping in the summer or spring that we might potentially be able to do that evaluation. She's also interviewing therapists at the moment to do with the auditory haptic feedback system. So if anybody is also interested in helping Emily Ann with her research work, which is part of the group that I lead. Another area that we're looking at is adaptive robotic coaching for sports and also for stroke rehabilitation. The project aims to explore how and to what extent an adaptive robotic coach has the potential to provide extra motivation to adhere to long-term rehabilitation, and we're working with therapists at the Astley Ainsley Hospital to see how we can actually undertake this. So again, anybody wants to join us in our research work, this is what myself and I know Mauro is all about. We want to work with stakeholders to build better human-robot interaction. So if anybody's interested in that, that'd be great. Next slide. So one of the ways that we've worked before and we looked at co-design is we've done some short exploratory projects where we've looked at proof of concept implementations of using small robots, for example, which may be less obtrusive in the home. And we've worked with health professionals and also housing associations. This was a small project that we did, which was just a pilot, where one of the issues that we were told about was the issue of false positives when it came to falls within the home. So the people were falling, but they were actually, a fall alarm was happening, but then actually they were getting up again. And so it wasn't a true fall, but then there were other falls where it was actually an issue and perhaps they hadn't been near enough to the fall alarm to raise the alarm to get some assistance. So we looked at how the Mauro robot could help with this, and I'll show you a small video in a moment, but the Mauro has sensors on its back, which actually you can touch and it will respond. It can also speak. It also has a camera within it where it can actually use computing vision, and these things we put together to show possibilities of how a Mauro, which looks a little bit like a kind of cross between a dog and a rabbit, could potentially help in the home if someone has a fall in both of the circumstances I outlined. So if we could show that video now, thank you. Thanks. So that was just a short video that we did, and it shows also this is environment that Mauro is going to go on and talk to you more about in depth. Next slide. So this is my final one. If you want to see more about the projects, the ITT group projects there, but also there's an HRI group as well, Heriot Watt, which you can search for, and you can also see us on Twitter, and you can see more projects there. And also, of course, I'm going to say follow the National Robotarium as we work towards that building being completed and welcoming you all to work with us in it. Thank you. Now over to Mauro.
Thank you very much, Lynne. Thank you, Nessa and Andrea. It's very nice. Thank you very much for having us. My name is Mauro Dragone. I'm assistant professor at Heriot Watt University, Institute of Sensor Signals and Systems, Edinburgh Centre for Robotics. I'd like to give you a quick overview of the Open Ambient Assisted Living project. I'm going to share some slides with you. The Open Ambient Assisted Living project is an impact acceleration award. It's a collaboration between multiple schools at Heriot Watt University. It's supported by NHS Lothian, DHI, the Data Lab, plus a number of research and development partners in the areas of IoT, telecare, housing, and robotics. As I said, I will give you a brief overview of what we are doing to promote open innovation in the area of ambient assisted living and robotics for health and social care application. I'll give you a brief overview of objectives, an overview of our expertise and facilities, and talk to you about what we are doing in the area of co-creation and what tools we are building to facilitate the co-creation in this area. The intention is to leave some of the time of this session to have an open discussion. We'd like to hear from you opinions and ideas about how we can work together in this area, and your idea of what is a living lab and how it can be used for bringing innovation in the health and social care sector. So the objectives of ambient assisted living is to accelerate the research in ambient assisted living, to provide, to create, co-create a scalable, socially acceptable and affordable ambient assisted living solution. We would like to explore where and how we can use it to the best effect our expertise in digital technology, in digital robotic technology, to help coping with the most urgent priorities, but in the long term to produce a scalable, socially acceptable and affordable digital and robotic solution that can actually help with the provision of quality, integrated and personalized care and support. The other objective is to create a sustainable platform, not just a one-off exercise, but to understand how we can not only overcome the difficulties we are all experiencing at the moment, but actually amplify our capacity to work together. First of all, we are combining our strengths. We have groups with expertise that is being applied to produce innovative solutions for contactless monitoring of activities of daily living and vital signs using radio frequency identificator technology or Wi-Fi or radar technology. We have groups that are world leading in conversational AI, the artificial intelligence enabling us to have conversations with Alexa Echo, Google Home, but also with social robots used for social tasks in healthcare settings. We have groups with expertise in core robotics, machine learning, and AI to make robots able to understand, move about in whatever environment they find themselves, and safely interact with things and people. Our robotic assisted living test bed is a fully instrumented smart home environment designed to study robotics and ambient assisted living solutions and create a data set that can be used to improve our artificial intelligence and machine learning algorithms. It is also a certified test bed for benchmarking assistive robotics. I will give you some examples. And often used to meet stakeholders. It provides the setup for training undergraduate and postgraduate students, but also professionals, for instance, in events such as the Ambient Assisted Living Summer School we ran last year with the help of St. Andrews University. This is a short video showing you what we do in the context of robotic competitions. This is actually a video from the European Robotic League competition. We hosted the last local tournament in 2018, And we test the robots for their ability to help us in simple domestic tasks, like you are seeing in these demonstrations. Our PhD and master students act as a referee, scoring the different robots. We are scoring not just the robotic design, but all the software, the artificial intelligence used to control these robots. As I said, our laboratory is a fully equipped instrumented to facilitate the creation of datasets. One example here is the use of RFID tags for activity recognition and for indoor localization. Actually, the user here doesn't have to wear anything, so it's not. We are not asking the user to wear a tag, but we are hiding tags. We are embedding tags under the flooring, and then we are using machine learning to understand the data and to understand where the people are, and what they are doing potentially. We are also producing some innovative data set, for example, using robots as observers of activity of daily living. If we want robots working with us at home or in hospital settings or other health and social care settings, robots will also need to observe us, to understand what we are doing, so that they can understand how they can help us. We are also producing innovative data sets in the area of human-robot joint action. If we are producing robots that are not just working for us, but working with us. We want the robots not to leave, to take us as our autonomy, and also to blend in with the current care and support practice. So working together with the carers. And this means if we are using these robots for physical aspect of care, it means that we want the robot to be able to jointly act with humans. This is a very simple example of a handover task. So the human is passing the object to the robot, and the robot is passing the object to the human, or putting it down, as in this example. We are working with a psychologist in Stirling University, Dimitris Kortis, who is collecting EEG dataset and study the neural mechanism that allows a person to plan an effective interaction with the robot. And this, we believe, will inform a new generation of robots that will be able to really adapt smoothly to the human they work with. We are part of a network of similar laboratories in the UK, in Europe, and in the world. But our co-creation approach is informed mainly by the UK RAS, the UK Robotic Autonomous System Network. And we are committed to use an active involvement approach, so to involve end users and stakeholders as active participants to the research, co-creators of the innovation. We know that there is a tension between what we'd like these robots to achieve, to perform for us, and the ethical concerns that those mixing with humans will arise. There are issues of lack of autonomy, issues associated to privacy, because these robots will have access to our more intimate environments, issues of security, and issues of suspension of beliefs and deception if these robots are used for social tasks. This is a picture of what we are doing at the moment in Open Ambient Assisted Living. In this project, we have done consultations with relevant stakeholders. This has been a huge learning experience. Site Scotland, for example, has been instrumental in helping us to put together an accessibility panel with the help of Inclusion Scotland and the Hearing Action Loss and other. The Coalition of Care Support Providers Scotland is helping us to connect with their members. We are having focus groups with specific end user groups to understand their key priorities. In January, we plan, and I will give you more precise dates later on. From January, we plan to run co-design workshops to come up with design briefs, ways that we can use our technology, combine our technology in order to bring some innovation in the sector. Finally, after January, February, March, and April, we run more workshops and complete the project with a hackathon. But what we wanted to create is a platform that we'll keep using and we'll move this model of working together in the new National Robotarium. And an example we aim to run is an ambient assisted living summer school, which actually will be the second edition of this summer school. The first we organized it last year. How are we doing this at this time of social distancing, shielding, etc.? We are using, so very briefly on the techniques and the tools we are experimenting with in this project, we are using the cloud to amplify our research, development, innovation, and the learning and teaching capacity. So this is the key idea from a technical point of view. We are using a number of tools, all supported by Internet of Things and cloud approaches to transform the laboratory into a collaborative online environment where multiple people can share the physical space, can work together, building software, testing software, and apply it to smart home, IoT devices, and robots. This is just a panoramic overview of the tools that we are testing. We have developed models, 3D models of our test bed. We are using innovative approaches to enable anyone to program our robots over the cloud. We are testing innovative examples of telerobotic presence. So I will ask you if I will invite people to visit our laboratory using either a teleremote, a traditional telerobotic presence robot, but also more innovative examples using augmented reality really to have an immersive interface, immersive experience of our laboratories and the technology that we are testing at the moment. We have cloud systems to enable people to work with our robots, to see what's happening in the laboratory, video streaming online over YouTube, and also to have access to the smart home or over the web. Some of the next opportunities to meet and work together. The first, the immediate one, on Thursday, 17th of December, we are running a focus group to go in more details on the scientific science and the technology, and to understand better the priorities of care and support providers in Scotland, and the CCPS is helping us to connect with these stakeholders. So please, if you represent one of them, please join in this focus group. If you want to visit the laboratory, please let us know. If you are a carer or a care support providers and would like to work together with a specific group with us from January 2021, again, please let us know. From the end of January 2021, beginning of February 2021, we plan to run our first co-design workshops. We'll have already a list of SMEs and companies interested in offering contributing their innovative products. We'll ask for more, and we are studying right now the right format to combine expertise from end users, which we want to involve actively in this ideation exercise, carers, care and support providers, and companies and researchers, of course, from in these co-design workshops. You find there the link to our website where you can hear more, you can see more information about the project, and there is also a way to subscribe to our mailing list, or you can just write me to get more information. So I hope I did well with time. In the next in the next part of this session, we would like to discuss with you your idea of a living lab, what we need to do to work together. If you are interested in this work we are doing at Heriot Watt University and more in general as part of the UK RAS network, we like to structure the discussion along these 4 points, which are the main activities recognized to be the responsibility of a living lab, a public-private people partnership, at least for the ENOL, the European Network of Living Labs. Those are co-creation, exploration, experimentation, and evaluation. For each of these items, we have a specific slide to remind you and to prompt you with some basic questions, what we'd like to hear, opinions and your suggestions in this area. I leave though to Nessa to facilitate the rest of this session. Thank you very much, Nessa. And there will be scope for asking questions, of course, in the next session.
Thank you, Mauro. Hopefully everybody can hear me okay. So Andrea, if you could take us to the next slide, please. Thank you. So Mauro has been explaining that we have these 4 areas that we want to ask you some questions on. And the areas are co-creation, exploration, experimentation, and evaluation. So we're just going to guide you through the next few slides, and it would really helpful to us, obviously, if you would contribute in the chat. I will switch my camera on so you can see I'm actually here, even though I hate switching my camera on, but I will do that. So don't be shy. That's the message I've put into the chat, folks. Please don't be shy. Share your thoughts and your views on this. So we're going to begin with co-creation. So if we could go to the next slide, please. Okay, so a living lab is a real-life test and experimentation environment. I'm not going to read the whole slide out. The focus for this part of the discussion is co-creation, co-design by users and producers. We've heard quite a bit during DigiFest about the importance of co-design and co-creation. I think it can mean different things to different people, depending on where you are sometimes, but really the essence of it is co-design by the users and the producers. So we've put some questions, some guide questions really here on the slide Mauro has provided. What are the priorities and the opportunities? What are the barriers? And how can we address them? So the easiest way to do this is for you to put your responses into the chat. So if I pick the first bullet point, Tom is hot off the keyboard and he says key priority for users will be practicality and security. Okay, so essentially, Tom, you've got it. I think everybody's probably got it. We'd like you to respond on each of these points in turn. Now, I should have checked with Lynne and Mauro beforehand, Lynne, so I'm asking you now, am I allowed to chip in here or am I forbidden?
For sure. It'd be interesting to answer Linda's question. So what we have there is you have a wonderful living lab. What plans do you have to progress your living lab into people's own homes, which of course have many additional challenges? I would completely agree with you, Linda, on that. I've actually undertaken studies before to do with after knee replacement surgery and also after injurious falls, where what we did was we built and tested the system and the technology thoroughly within the lab, and that's what the assistive living lab's for. We test everything and then we test it again with, of course, end users and any stakeholders, physios and so on. And then when we're happy that it's robust, it's going to work, that's when we move it into people's homes. So one of the things with assistive living lab is we can get a lot of things wrong within a nice, safe environment.
Just to elaborate my answer to Linda Webb, who's asking what plans we have to progress our living lab in people's own homes.
Did no one hear me there?
Which of course has many additional challenges.
Oh, we heard you, Lynne. We heard you. Don't worry.
Okay.
Okay, Mauro, Lynne was answering that point that Linda had raised.
Okay, sorry, I didn't hear. I don't know why I'm not hearing Lynne.
Okay, Lynne, if you carry on.
Yeah, so I think, and also as Mauro was elaborating we are also hoping to test things in the community. One of the things that North Glasgow Homes, for example, did with the study before was they gave us one of their empty apartments, so one of their empty flats, so that we could actually test, so take it from the assisted living lab and then test it in an actual flat itself before. So we try and take everything a step at a time so that we ensure the safety, security, all these different things are looked at with the different stakeholders who are involved. So that's what we would hope to do here, which is why we're talking to people like Blackwoods, also other care providers. If we can get more test beds within the community as well as the assisted living lab and connect those all up, it means that we can have that full life cycle where we go from the concept and ideas that we're starting to do at this point right through to finished system, which we test in these different environments. So I hope that answers Linda's question.
Okay, thank you. Thank you, Lynne. Linda, feel free to contribute back into the chat. And Tom has elaborated a little, which I think is quite an important part regarding Internet of Things devices, which can contain a security risk, a video device which could contain privacy and ethics challenges. And these are points which have come up frequently over the course of DigiFest in relation to different devices in different settings with different groups of users. So in terms of barriers, are we thinking about these in barriers in terms of the researcher point of view or from any of the stakeholders, citizen point of view, the researcher point of view, etc.?
I think what's interesting, and I should let people know, is so whilst I'm leading the human-robot interaction and assisted living lead for the National Robotarium, we actually have an ethics lead as well, because we thought that was very important. And the ethics lead is also an expert, just a professor in AI as well. So basically, we're really taking this very seriously. We understand exactly where a lot of the security risks are in the collection of data specifically as well. If you're monitoring someone's home and collecting sensor data, you can collect a lot of information about them. So again, this is another reason why the assisted living lab is going to be so vital, is that we can actually have a fully censored environment, but then start removing some of the sensing and seeing if we can still provide the full care that's needed, but collect less data. So only collecting data that's absolutely essential, and then making sure that when we do so, it's ethical, it's within all the laws and so on that are around this particular area. But I think there's a lot of work to be done on that, and we get new types of sensors all the time, and so there will be continuous work within that area for sure. I'm sure Mauro might have a couple of points about that as well.
No, exactly what you say. That besides the privacy, I would also say that we know that there are security considerations that we have to take into account if we are employing robots in domestic or other environments. And but this is a topic of research, and Heriot Watt University is leading a UK-wide initiative to build accountability and trust in autonomous systems.
I've just been chipping in, and thank you. Martin's also been adding in. So for me, and I understand your point, Lynne, and it's very well made, and Mauro, about that you are considering and have been considering in great detail the ethics and the accessibility in some of these challenges. But I guess when we ask the audience this kind of question, it's these are the immediate things that come to mind. At least for me as well, I would say. So I had added in. How do you overcome some of the barriers? One of the things I would have suggested would have been the widest engagement possible from the earliest stage possible, a consideration in detail of the risks, which you have described around the ethics, at least, that you're doing, and taking the appropriate advice, which you've described. Other challenges, not necessarily barriers, but challenges would be things like basic digital access of the participants, depending on what it is you want them to do. I don't know what other people feel about that. Something we've heard over the course of the past few days, for some examples, was language, and also capacity has come up in some of the other sessions. So I'm just putting them in there as potentially. So I'll go back now to the other speakers because it's not about me. So Martin has put in opportunities. Thank you, Martin. Great to have some opportunities. Support in both care homes and settings. and care at home settings, which, yeah, very important to make that distinction. Support for prevention and early intervention agenda, all good. And Tom's also come in again to say the concept is fabulous. If can be demonstrated, then I think this has a massive impact for issues of social isolation and responder management, first-class research. And I guess that's part of this, isn't it? How do you move research into everyday sustainable digital health and care services? And thank you, Linda, for the contribution about the study that found people were happy for shadows of themselves and very acceptable rather than full video. A lot of data still has value. So I'll let you come back, Lynne, just on that.
Yeah, I think that's a very interesting point about the shadows. I think also it's interesting. There's also contradictory research. So one of the things they found was that if you show a bit too much, so that it can actually upset people, especially if say on playback. This was particularly to do with stroke patients. They didn't visualize themselves as a stroke patient, and so when they actually saw that visualized, even if it was as a stick figure, they actually found it quite upsetting. So I think this obfuscation is actually quite a difficult nut to crack. You know, how much to show to the point where you enable understanding, and what do you kind of try and hide so it doesn't upset people. So I think it's a very interesting area about data and exactly how much you share and how much you don't, and what you collect and what you don't. I think is very interesting.
If I may add for Linda remark, in open ambient assisted living, what we are doing is to embed the ethics and the panel of experts of ethics and privacy issues in the co-design. So what we are planning to do is to ask them to run a risk assessment for any design idea that we come up with. And the point is not just to check that there are issues, but also to make people aware of what those issues are. Sometimes users may come up with an idea, but they don't know, or they have no a clear understanding of what are the ethical issues associated to that idea. So we are planning to investigate this trade-off between what comes up from the design and what are the risks from an ethical point of view.
Thank you, Mauro. That's a really good point. That point about balance between usability, between access, between security, that has come up again and again. It's a challenge, but it's a really interesting question also. How do you achieve that? Just a point for Martin. Martin says a potential barrier, digital, including basic network access, can often be limited in care homes and care at home, but also a lack of digital literacy skills. And we've talked at some length about digital literacy, but also digital health literacy. And Linda's come back in. Of course, it's different between individuals, adding a further challenge. Yeah, I noticed you had replied to Sharon's point earlier, Lynne, about who you were seeking to engage with for the focus groups. And I was just going to give that a shout out. It was a bit earlier on, in case anybody had missed it. So in end users and also stakeholders, the target end users is anyone who would benefit from assistance in an assistive living scenario. That's harder to say than you think. So just to remind people of that. Vary McIver asked a question. I'm not sure where this fits in this particular bit, but I'm going to put it in case we miss it. She said she's interested in wearable robotic exoskeletons for home carers. Is that something the Living Lab would support?
We have some of our academics with expertise, or at least they are looking at this exoskeleton type of solutions. So we could put in contact with them to elaborate more about this. It will be interesting, I think. I hadn't noticed the questions about user groups by Sharon. so to respond to Sharon, basically we are doing user groups for the moment in an opportunistic manner. If we have user groups that are interested in engaging with us, we'll try to organize a focus group to understand what we need, if there are accessibility requirements. So we have done one with the help of Sight Scotland. We plan eventually to do one with a focus on hearing loss. And our aim is to have a bigger focus group looking just at healthy adults with independent living requirements. And then we like to have the view of carers and care and support providers. That's our plan.
Okay, thank you, Mauro. I'm just going to ask Andrea to go on to the next slide, if that's okay, just as conscious of the time. In terms of opportunities, again, I shouldn't be flagging up my own comments, really, but I am. I'd suggested linking in with other initiatives. I think you mentioned that, Lynne, that you're already connected with other organisations, but I think given the work that's going on with Connecting Scotland, with other specific voluntary sector organisations in this area, that's a brilliant opportunity, isn't it, to kind of connect up and help each other out and deliver something that's more useful at the end of the day. So the next slide we have is on exploration. Hopefully everybody can see that. So in this context, we're talking about exploration, discovering emerging usages, behaviour and market opportunities. And again, we're asking you just to think about and contribute in the chat, please. What are the priorities and opportunities you see in relation to exploration? And then we can flag up maybe some of the barriers and how we might address them. So if this is an area that you have particular experience in or you have views on, please do share in the chat. And again, I'm going to use myself as the guinea pig just to get the ball rolling, give people a chance to type. And this is maybe just to clarify for me, Lynne or Mauro, when we talk about exploration, discovering emerging usages, do things like wearable devices come into this? Is this something that would fit in here in terms of the market?
Yeah, absolutely. I mean, this is one of the things that Emily Ann's was showing was, you know, haptics, how can we augment, not just use, it's not just about robots, I'm sure Mauro would say that as well, it's about the full kind of assistive market, so we can, wearables, absolutely, also sensors, which we can put within the environment like RFID, but also robots and just bringing them into the mix. But this could also have connections to somebody's mobile phone as well. So there's no kind of things that are out with what we would look at technology-wise.
Okay, thank you. That's really good. From my point of view, I would suggest that we've had some interesting conversations recently with our international colleagues about where wearables come together, maybe with telecare or assistive technology in the home, as other people might refer to it. And we're not there yet, but there's certainly a lot of interest, it seems to be, in that area of discussion.
Of interesting things to do with, so thinking as our colleagues that do smart textiles, for example, there's lots of interesting things that you can do. You know, you can have a smart dishcloth, for example, and you can do different things within this environment that you wouldn't immediately think of within what we do. But, you know, we do have opportunities, like Mauro says, that we're happy to work across schools and across universities. Don't feel that we're just focused. So as I said, we've got smart textiles. There's a lot of interesting things around bandages and compression and all sorts of things around that as well. So it's an interesting area to look at.
I'm just encouraging people to chip in. Richard says, Nessa just beat me to the question, was going to ask about telecare. Sorry, Richard. That's not a bad sign, though. At least, you know, we're roughly in the ballpark. Telehealth and what contributions have been received. I don't know if you want to say any more about that. I'm not sure if, Richard, you're talking about the overlap, is where I was thinking of it, between telehealth and telecare. Lynne or Mauro, is there any more you want to say on that?
Well, I can say that we have a number of SMEs that have expressed an interest in working with us, and some of them are from a telecare and telehealth sector. Examples are producers of smart home applications that can use your phone, the camera of your phone, to measure your blood pressure, oxygen levels, and heartbeat rate. So it is an example of SMEs innovating in this area of telehealth. Telecare companies are also interested in working with us, trying to understand how they can fit mostly new sensing, innovative sensing on one side, from one side, and innovative services from the other side, for example, using robots.
Okay, thank you, Mauro. Just check. That's what I was interested in, says Richard. So thank you, Mauro. You've doubly answered that question. And Tom has reminded me, is it overlap or synergy between telehealth and telecare? I could guess Tom would say it's synergy, so I'm going with synergy as well. In terms of some of the challenges in terms of exploration, what are the barriers or challenges? Again, I think many of the things from the previous slide in a way would pop up for me immediately, and happy to be corrected by Lynne or Mauro. So when I read that slide, I thought about connectivity, remoteness and rurality, perhaps affecting connectivity. Trust was another one that kind of leaps into my mind, and some of the more practical issues around how you engage with people, actually. So moving away from the technology as such, but how do you engage with different groups of citizens, stakeholders? How do you get access to people to work with them in the first place? That's something I find quite interesting, and I don't know if you want to say anything on that. I can remember many years ago being involved in research projects where you had to go through multiple layers of gatekeepers to get access to patients, for example. Is this something where you kind of put a call out, or you have a panel, like a citizen panel, who you're ready to be recruited, or is it through your research networks, or is it through health and care professionals? And how does that bit work, I guess I'm asking?
In the project, we have issued a call, and we have asked help with the different organizations that we have discussed this with, such as CCPS, Scottish Care, Inclusion Scotland, Sites Scotland, and they have contacted their members, basically. And we have a Qualtrics questionnaire where we collect interest in the project, and that we use as a pool to organize focus groups. Plus, each group, as I said at the beginning, it is a collaboration between multiple schools. Each group have their own pool of users that they usually access for user studies.
Thank you, Mauro. That's really helpful. And just for anybody who's into their acronyms, is that the word? CCPS, Coalition of Care and Support Providers in Scotland, an umbrella organisation that some of our listeners would be familiar with. Okay, if we can move on to the next slide, please, Andrea. So we have experimentation. Experimentation, implementing live scenarios within communities of users, and really important to stress, communities of users could be employees, carers, or residents of retirement homes. So again, the similar bullet points, you see the pattern now emerging. Where do you think the priorities and opportunities lie? Where do you think the barriers may be? And do you have any suggestions or experience or ideas for how you might address them? So I'm encouraging you folks to join in on the chat. Once again, I'm happy to use myself as a guinea pig to give you a chance to look at that slide and type. For me, and this is a bit similar to the last slide, I guess, the immediate thing I thought about, I don't know whether this shows I've got a negative mindset. This is maybe not something you want to think about particularly on a Wednesday afternoon, but I thought about workload was the first one. And how, again, a little bit about how you engage with people, but I was thinking about staff specifically, perhaps in care homes or retirement homes or working in care at home. And I was thinking really about their workload as a challenge. I don't know if either of you want to come in on that and tell me that's nonsense, Nessa, that's not an issue. Happy for you to do that. And also a bit similar to the last conversation, last part of the conversation, I was thinking about gatekeepers, and I know, Mauro, you've addressed kind of addressed my point on that, so you don't have to go back to that. The other thing I thought about in terms of barriers, I'm focusing on my barriers first to get them out of the way, was actually understanding what it is, whether the people you engage with, how do they really understand, and this sounds really patronizing, but I'm going to say it so you can shoot me down afterwards. Do they understand what it is you want from them? That's probably the simplest way I could explain that. Does everybody involved understand what it is you want for them and what's in it for them? So here's your opportunity to to go on the attack, guys. Mauro, yeah, sorry.
I'm not sure what is the question. I mean, at each event we wanted to learn different things. So in focus groups, we want to learn what are the priorities, what people find the most challenging. For example, in the focus group we had with the help of Sight Scotland, we were just trying to understand from the lived experience of people with sight loss, what they found challenging during lockdown, for example, what they find challenging in this phase of the COVID crisis, and in general, what they find challenging in their daily living. And we also asked them to comment their use of technology and whether they see some of the emerging technology useful for them. Try to understand if there are issues that we need to resolve with further research. So that's what we are doing in focus groups. In co-design workshops, we will sit together, metaphorically, to understand, to come up with a novel ideas of how we can combine technology to provide some help to end users, to carers. So there are different events and different things that with different objectives. For experimentation, we like to have, as I said before to Linda, to have test beds embedded in the community. There is so much that we can do in a laboratory settings. We are trying to recreate a domestic environment, but in a IKEA showroom. It's not a domestic environment. We are not living there. We need to have sensors and technology and robots in nursing homes, in care homes, in housing, in people's home, and leave them for long, not just 1 hour, 1 day, or 1 week as we did in the past. So that is really requires an effort and an understanding how we can do that together.
Yeah, and I think one of the definite barrier is, and certainly I've come across before, is that we're computer scientists. I know Mauro's more on the engineering side, and so we don't really understand how care homes are set up, how we can practically implement and have, the systems that we build be put into these places and not be disruptive to the routines and the other day-to-day activities that need to be undertaken in the home, which, as you say, Nessa, is the home's focus. It's not testing our new technology for us, it's the day-to-day care that they have to provide. So how can we get a balance where there's enough of a trade-off or a benefit, or they can see a long-term benefit to actually helping us and facilitate that more living lab proper experiment in these settings.
Thank you. Sorry for the woolly question, Mauro and Lynne, but it's a challenging one, actually. I mean, I was thinking about schools as environments. I was thinking about day centres and obviously care homes and care at home settings. But exactly, Lynne, you've put the nail on the head that getting access is extremely difficult. It's not impossible, but it is extremely difficult, especially at the moment, and this past year included, when the priorities are elsewhere. Simple as that. And I wonder if some of that balance is about how the residents and the staff in settings like that, how valuable or engaged they feel with the whole process. That's what I mean by what do they get out of it. I don't mean a monetary gain. I mean, are they learning something new? Are they having a different experience? Are they just having fun? Is it just enjoyable? Are they having the opportunity to participate in something they have never done before? Is that what they get from it? And the sense that they can contribute to something that actually might become a usable product, service, etc. So that's my ignorance, but that's the bit I don't know about, what people get.
I think what you said is an inspiration for me. All of the above. We are not promising solutions to specific people. We are not promising to solve people problems. We'd like to understand what are those problems, and we'd like to involve them, so that, as Linda said, if there are people that just want to give us their feedback, that's good, welcome. If there is people with a technical background that want actually provide some help with programming or prototyping, that will be fantastic if we achieve something like that in our co-design workshops.
Okay. Andrea, do you want to move on to the next slide? Just while you do that, I'll just pick up briefly on the points. Linda, I absolutely agree. I hope it didn't come across that I was saying people couldn't contribute. I just think it's really important to explain to anybody when they're participating in any activity like this, what you expect of them, what might be expected, what they might gain from it. And you can have that open conversation with people that goes both ways. Tom has just chipped in. Biggest barrier is communicating the vision to the audience, and there are many, so need to ensure the vision is explained in lay terms to all the stakeholders. And just to, again, pick up on the rest of Linda's point, sorry, scrolling has stopped. Older people themselves who are, there are many, yes, of course, there are many disabled and older people themselves who are very well educated professionals, and there's a huge expertise in the population, and they have things to offer. Yeah, but I suppose my point is you have to get you have to get to them first, and engage with them so they want to be involved. They might be busy. Okay, next slide. I think we have evaluation. Sorry, folks, my screen is not quite there, so we should be on evaluation. Okay, now I see it. Evaluation, the assessment of concepts and products and services. I'm just going to go quickly on this. Apologies, Lynne and Mauro, just for time. What are the priorities, the opportunities, what are the barriers, and how can we address them? So evaluation, assessment of concepts, products and services according to socio-ergonomic, socio-cognitive, and socio-economic criteria. Okay, I'm going to have to ask Lynne or Mauro to explain that a little bit more, please. Thank you.
My understanding is just that whatever we come up with, whatever we want to test, to evaluate, we'll need to blend in with the current care and support practice. Will augment, perhaps, will provide more flexibility, more promptness, but it will have to be adopted. So it's important that it will respond to real needs of in this sector. So that's the socio-ergonomic. And obviously it needs to be, we said at the beginning, we are looking for affordable and sustainable. One of the main drawbacks of the robotics, especially robotics to date, is that they are very expensive platforms. So maybe affordable to hospital, to a large housing organization, but definitely not to home environment. But you can see from what Lynne showed at the beginning that we are using as affordable, new affordable robot. The Miro that Lynne used in her own research is developed by a spin-off of Sheffield University. We are using telepresence robots that again we consider affordable for organizations. We're talking about from between £2,000 and £3,000 for the most for the cheapest platform.
Couldn't hit mute and unmute and type at the same time there. Thank you. That's really helpful, Mauro. Just asking if people have any other suggestions. So I think I understand a little bit better how the cost balance works, how it fits in socio-ergonomically. I want to say economically, socio-ergonomically. Lynne, did you want to offer anything in there? No? Okay. I'm not seeing any new chat on this one. If anybody has anything else to add, this is your chance to do it, folks. So how do we address them in terms of evaluation of these concepts? I would suggest, and this is me offering myself up once more, I would suggest spin-out opportunities, research and development opportunities where you can somehow keep the cost low. But then I think the real challenge there surely would be, how do you actually make that into a scalable solution? You might be able to do it quite well, and it might function really well, quite cheaply even, in a closed kind of contained environment. But then when you want to scale it up, does it become really difficult to do that, to make it a service or a product? I don't know. I'm just saying to see if that kind of stimulates a question or a response. Richard has chipped in. Thanks, Richard. If COVID has taught us one thing, it's to take a sledgehammer to the barriers and go for the opportunities. Thank you, Richard. I really like that positivity.
I think it's a very good to end. It's a very good way to end. Nessa, could you move to the slide where we remind opportunities to keep working together? I'm conscious the time is finished of the session. Thank you very much. So I remind the next opportunity is 17th of December. Please visit our website or email me if you want to join any of these opportunities. We'd like to have a longer opportunity to discuss more in details the priorities of care and support providers on the 17th of December. If you want to visit the laboratory, if you want to participate to a focus group, and if you want to participate to a co-design, I should say it's not going to be one-off exercise of co-design, but it's going to be a series of co-design workshops. So we would like to have an iterative approach to go to the ethical panel and to feedback into the co-design teams, etc. Thank you very much for everyone. Thank you very much, Nessa. And
thanks, everyone. Yeah, and please do come to one of the workshops.
Thank you. And just to say, the recording of the session will be available, should be available by tomorrow. I'll copy the chat so you can have access to that if you would like. We shared the link for the workshops in the chat, but I will share it again at the end of the session.
Thank you very much, Nessa, Andrea, everyone. Bye.